Hello, my name is Patricia Rice with the Colorado Foundation for Universal Healthcare. The foundation promotes the idea that everyone should have access to healthcare. Today, I'm talking with Jim Potter, Legislative Liaison, excuse me, for the foundation. Jim came up with a great idea to bring universal healthcare to Colorado. Instead of asking legislators to formulate a bill that would detail such a system, he wrote down a list of essentials necessary for a universal healthcare system. That way, legislators can use the essentials in drafting legislation that would eventually send these essential ideas to the voters of Colorado. So far, two sponsors have stepped forward to carry the legislation. Representative Andy Basenecker of the Colorado House of Representatives and Senator Sonia Hawkes Lewis from the Colorado Senate. Is there anything else you want to add to that, Jim?
Well, this list of essentials was a group effort. We do have a bill writing committee within the foundation. And so several of us worked on the essentials. It also follows on the report of the School of Public Health that came out last September as a result of the Healthcare Cost Savings Act. And that report concluded that a publicly financed nonprofit health insurance plan would save billions of dollars, create jobs, and cover all Coloradans. So that was an important development. So we decided that basically, rather than put to the public a really detailed bill where everyone can find some aspect of it that they don't like, let's put forward a general advisory question to the voters to have them look at the essential elements that everyone agrees would be a comprehensive plan. So that's how we came up with basically 10 essential elements. And I can run through those if you like.
Yes, please do.
Okay, so the first is that it is a plan that would provide comprehensive benefits for all medically necessary care. And that would include dental, hearing, vision, and mental health, which typically are excluded from private health insurance plans. So this would be much better than what people now have on the private health insurance market. It would also provide, as the second point, long-term care and home care, at least at the level of coverage that currently is available to Medicaid people in Colorado. This is an important added benefit, and it assures people that they won't lose any benefits as a result of the state program taking over what was the Medicaid aspect of healthcare in Colorado. Third, healthcare decisions would be made by patients and their providers. Fourth, patients would have free choice among providers. Fifth, it would cover all Coloradans, regardless of immigration status. Sixth, the system and its cost of care would be funded by premiums based on ability to pay, rather than based on private health insurance companies need to make a profit, and therefore setting the rates of payment not on ability to pay, but on what health insurance companies want in terms of their profit margin. Seventh, the healthcare would be prepaid by premiums with no deductibles or copays that create barriers to care. Right now, copays and deductibles prevent many, many people who have insurance from going to the doctor when they need to. Eighth, the agency would ensure fair drug and hospital prices with an ability to negotiate. Ninth, it would be a publicly administered nonprofit enterprise, and it would be the sole agency that would cover Colorado's healthcare costs. And finally, to avoid profiteering, there would be no middlemen with the power to limit benefits or impose other barriers to care, unlike what we have now in the private health insurance market, where you have to get pre-authorizations for care. There are limited provider networks. There are all kinds of exclusions that operate as barriers to care. Those would be eliminated. So that's basically the outline of what we are proposing.
Well, that sounds like a true, excuse me, my voice got hoarse here. That sounds like a true universal healthcare system. So what happens when voters approve of this legislation? What happens after that?
Well, that approval would then really be a mandate for the General Assembly to come up with a more detailed plan that incorporates all 10 elements. And then that more detailed plan would also have to be voted on by the voters. So it's a two-step process that we are proposing. Now, there's a lot that can happen between now and then. I mean, we do have 2 legislative sponsors, as you indicated, and they're going to hold stakeholder meetings, and there are going to be, a lot of discussion about the elements that are required and the details. And we welcome that discussion. That's the way forward, we believe.
Okay. We know that the insurance, pharmaceutical, and for-profit hospital industries are going to be against a universal health care bill, as they have been across the country. What can people do? What can our supporters do to ensure that this legislation passes?
Well, one thing is participate in the debate. We welcome this debate. We look forward to debating with the private health insurers over what kind of coverage they provide versus the plan that we are proposing. Voters who support this plan can do a number of things. First, they can go to couniversalhealth.com, press the button at the top of that website where it says Act Now. Then there'll be a pop-up, sign petition. So sign the petition that promotes this healthcare plan. They can also write to all of your representatives in the Colorado General Assembly. Tell them about this proposal and that you support it. Tell your friends about it. Talk it up. And if you belong to organizations, ask your organization to sign on to the petition and to support this effort. Also, post it on Facebook. So there are a lot of things that people can do.
Okay, you can also go to our Facebook page or our website and donate, because this is going to cost us a lot of money to counter the opposition that we expect to occur. Anyway, thank you so much, Jim. This has been really enlightening, and this looks like a very important step forward for universal health care in Colorado. Thank you.
Well, thank you for bringing it to everyone's attention, Patricia.
You're welcome.